Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And I would like to welcome Dr. Kevin Poe. Thanks for joining us today, Kevin.
Kim, super excited to be here.
And I'm super excited to have you. And actually, this is going to be episode number 100. And it's just the way it worked out. And I wanted to have a special guest for episode 100. And this is what's happening. So it makes it extra special.
I'm honored, Kim. Thank you so much.
You're welcome. I'm honored to have you. And by way of a brief introduction, Dr. Kevin Poe is a practicing internal medicine physician, media commentator, public speaker, author, and the owner, founder, and editor of the KevinMD platform, social media's leading physician voice. And I wanted to add just a few adjectives that include kind, approachable, and inspiring. And that's, what I've come to know you through our conversations. And today we'll be talking about the overall theme Kevin likes to promote is that doctors are more than their degrees, which I think is an absolutely critical message. And we'll have Kevin talk about his website and podcast platform and how it connects doctors outside of medicine. And also Kevin's Speakers Bureau, which I don't know much about yet myself. So as we get started, what would you most like our audience to know about you?
Well, thank you again for having me on. I'm Kevin Poe. I'm an internal medicine physician. I practice in Nashua, New Hampshire. I do primary care, and for those who listen to me and read Kevin MD, I'm a big proponent of primary care. And as you know, there are shorts the country, so I encourage more physicians to stay in primary care and more medical students to consider primary care. But I started KevinMD.com almost 22 years ago, right? So that's a long time. So back in the infancy in social media, and it certainly evolved into the platform that you know today, talking to you and meeting physicians from all over the country and having that opportunity to share their stories, share their voices, and hopefully move the needle and improve our healthcare system, both for physicians and for patients as well.
Absolutely. And I love your focus on primary care. And thank you very much because I think primary care doctors are undervalued. And just think that it's critical. And so I love that you spotlight that. And thank you for your work. As hard, difficult as things are, that you're still showing up and, providing your patients with the best care. So thank you. And my primary care doctor is in my heart all of the time. And so, if you would like to speak a little more to how your website and podcast platform connect doctors outside of medicine.
So, like I said before, I talk to a lot of people across the healthcare spectrum, not only physicians, but patients and non-physician clinicians as well. And they submit stories and contribute their perspectives on Kevin MD, and I publish that. And I'm really fortunate to really build up the readership over the last 15 to 20 years, where people who write to Kevin MD, they say it's a safe space where they can share their thoughts, because when they write for other publications, they don't necessarily have that editor where that editor is a physician. That editor can really sympathize and empathize with what's going on in the healthcare field. So we connect doctors that way. Of course, the the articles get shared on social media, and that really propagates that discussion. I always offer my guests an opportunity to appear on my daily podcast, the podcast by Kevin MD, so we can really hear the voice behind that article. And I've met thousands of people across the healthcare spectrum, just like yourself, or really can talk about what they're passionate about, talk about their story, and allow them to share their perspective in their own words, in their own voices. So that's been tremendously gratifying to really act as that amplifying force and that platform where they can get that message out.
Well, I love that, and we'll talk a bit more about it in a minute. And I was also wondering if you could speak a little to your Speakers Bureau, because I actually don't know much about that.
So this was more prominent before the pandemic. So I think before the pandemic, a lot of people would wonder what is that intersection between healthcare and social media? Because whenever physicians would talk about social media, it's always from a perspective of risk. You always hear about healthcare professionals get fired before because of what's happening on social media, and there wasn't a lot of positive force behind why physicians should be involved with social media. So I wanted to share my story, and I always say that social media, and that still applies today, is a fantastic opportunity where physicians can clear up a lot of the misinformation that patients are reading online. A lot of patients are going online to get their healthcare information, and now in 2025, a lot of that content moderation on social media platforms, they're really backing down. So there's a lot of misinformation, especially when it comes to health online. So I do think it's an imperative for physicians to go online and really either be sources of reputable healthcare information or clear up misinformation. I think it's important for physicians to go online also to define their online reputation because patients are, of course, Googling their doctors. And of course, there's that advocacy piece, which you and I know about. It's important for physicians to share that voice. So, in terms of the Speakers Bureau, a lot of organizations wanted to hear a more positive perspective of social media. So, I keynoted events across the country trying to share that message. And then we realized that a lot of physicians, they're not the most accomplished speakers, right? Because I think that if you look at TED Talks and a lot of the speakers online, their message really resonates because they're really fantastic speakers. So I set out to find other like-minded physicians who are just as good on the stage as they are in producing their message. So I do have that Speakers Bureau, Physician Speaking by KevinMD, where we have 10 to 12 other physicians. We talk about topics all across the healthcare spectrum, not only social media, but we talk about things like physician burnout, artificial intelligence, um, any topic that you could think of. And or I reach out to organizations who are interested in having an inspiring physician speaker who can share a message from the physician standpoint, but also inspire audiences from the stage.
Wow, well, I love all of that, and I bet a lot of people don't know about that aspect. So I'm very happy to share that. And I'm actually going to take it'll take me about a minute to share our background story because a lot of people won't know how I came to know you. And I'd like to end with a question for you. And so in March 2022, I believe your site popped up on my Facebook feed because Dr. Michael Hirsch's did, and I had clicked on it.
Mhm.
And prior to that, I wasn't involved at all in these spaces. And I was in the midst of radiation treatments following my second surgery for cancer in the span of just over a year, and not knowing that less than 3 months later I'd be on the operating table again, for another cancer and another round of radiation. And I started reading every article on your site for the next year, and you were instrumental and the foundation of my education along with ordering books published by physicians featured on your site. And I became very concerned about physician well being. And as you well know, there's no words to describe my shock and devastation at losing one of my own doctors that fall. And Michael and I had our first conversation a couple months later. And at one point, he suggested I write about my doctor as I was really struggling. I shared with him what I wrote, and he encouraged me to submit it to you. And so that's my first published piece ever, and my first ever podcast was with you also. And you and Michael have been part of my journey doing this work since the very beginning, though none of us planned it or saw what it was or, will come of it. And we kept going. So here we are, a couple dozen articles and podcasts later, collaborations now, primarily with physicians. And whenever I tell my story, which is quite often, you and Michael are part of it. And you're both mentioned in my intro episode, and that's my most watched one. I think it has about like 400 views at this point. And it feels like we amplify and support each other, though we've never discussed it and we've never actually had a conversation outside of a podcast. And I've wanted to ask you, like, what do you make of it? And I just wanted to add that at the end of our podcast with Dr. Todd Otten that we recently recorded with you, we've been told that we're super connectors each in our own way. And I was wondering if there's anything else we could do together to best maximize these ripples of change, or are we already doing it? So anything you wish to share.
I love hearing that story, Kim. And I think the one part of that story that really resonated with me is that as a patient, before you got involved with the physician advocacy work that you do, you said that you didn't know some of the stories that physicians shared. You didn't know some of the struggles and obstacles that physicians face. And that's really the key. And that really strikes at the core of what I try to do. Because whether you're a patient or whether you're a clinician, we both want the same thing. And that's really the best care that we possibly could give to patients. And there are so many obstacles in our healthcare system that really drives a wedge between that goal and what we do. And a lot of the issues that physicians face, and you talked about things like physician burnout, and we talk about the electronic medical records, pre-authorizations, and all the administrative and bureaucratic hassles that impede physicians. Patients simply just don't know about it, right? Because they don't know what goes on behind closed doors. They don't know some of the struggles that we face. And it's only by having platforms like this and having conversations like these on our podcast where we can really share those stories and allow physicians to express themselves and share some of the frustrations that they have in practicing medicine every day. And really, it's not to benefit physicians. Of course, it's to benefit physicians, but really, that's not the primary goal because the primary goal is to really give the best care that we possibly could to patients. And if physicians are burnt out, if they have to spend all this administrative time doing non-clinical things, if they have to deal with insurance companies and prior authorizations and jumping through all these hoops to order tests and order the right medications, that's really not only frustrating for physicians, but it should be top of mind for patients as well. So when we talk about these issues that may seem physician centric, the end goal is that, hey, we want the best care that we possibly could for patients. We need to be on the same side. So that's why I think it's really powerful what you're doing, of course, from the standpoint of being a physician advocate, but also from your perspective as a patient to really amplify our voices, share our stories, because we both want to move that needle in the same direction.
Right, 100%. And I love it that it's, patients and doctors talking together about these things. And so many times I've quoted Dr. Kathy Stepien had shared something she said with me that everyone wins when physicians are well. And if physicians are not healthy physically or emotionally, if they're exhausted, if they're burnt out, you're not going to get the care that you need. And physicians are going to leave and you're going to be waiting even longer to see doctors. So even, if someone wanted to look at it from a selfish perspective, as a patient, if you want your doctors to be there for you, you have to be there for them. And so one question that you've asked your guests, including me and some people I brought on, is do you think the needle is moving in healthcare? So I'd like to ask you the same question.
Sure. So I think that the needle is moving partly because of what we're doing with social media. And a lot of physicians now have platforms where they can share their own unique perspectives in our healthcare system. When I started this 20 years ago, there were maybe a handful of us on social media, and a lot of doctors were just doing their own thing, whether it's in the hospital or behind closed doors in the exam room, and really only making a difference one to one with patients. But now with these platforms, not only can we talked among ourselves, but we can share our message to many people, of course, at once, right? So if your goal with being online is to clear up misinformation, you could talk to thousands of patients at once. If your goal is to advocate, you could talk to thousands of policy experts at once by sharing your stories. And of course, if you want to support other physicians, you could share your story on social media or on these online platforms and really bring like-minded individuals together and have that conversation where you could have that peer support. So I do think that we are moving the needle. If you go to LinkedIn, I'm sure you do every day. You see that every day. Whenever you post something on your feed, Kim, you have a lot of other physicians who support you in the comments, who like your posts, who favorite your posts, and that momentum has been really instrumental in moving the needle in terms of not only amplifying the obstacles that physicians face, but really finding solutions for them as well.
Well, and thank you. And that's what I'd like to do is, of course, shed light on the struggles and the difficulties. But I'm a positive person, and I think it's so important to offer a message of hope for physicians. So as we start to wind down, only because I know you have another recording of your own to do, what else would you like to share? If you have any top tips for your colleagues or any suggestions for patients who wish to support their doctors, just anything else you'd like to share with our audience. And also, how can our listeners get in touch with you?
Sure, sure. So, I think that in terms of tips for other physicians, I do think that it's important to share our story and don't be afraid to share our story because when you do, you'll be surprised in how many other physicians are going through the same struggles that you are. The other thing that I want to also say is that can't be afraid to be vulnerable by sharing our stories. Whenever physicians are in training, we're always conditioned to look past ourselves and not think about our own welfare and only devote ourselves to a lives of medicine. And I think that type of mentality is really contributing to the physician burnout crisis. So it's important to be vulnerable, ask for help. If you are feeling burnt out, go out and seek that support because the last thing that our medical system needs is fewer physicians because that's only going to hurt patients, as you say, in terms of the physician shortage. And I think too many doctors are afraid of being vulnerable. So I think that um, on my podcast, I've talked to so many physicians who, like you said earlier, kind of shared their story for the first time, and they were so surprised not only in the benefits their vulnerability showed, but also connecting them with like-minded individuals who also said, "Hey, I'm going through this too," and that support can really, really make a world of difference. So the overall message to physicians, other clinicians who may be listening, is that not only share your voice, don't be afraid to be vulnerable. You mentioned how to connect. Go to kevinmd.com. I'm always interested in hearing stories from people across the healthcare spectrum. So you could share your stories. I'll publish it on KevinMD, and then you always have an invitation, just like we're having on this podcast, to talk about it. So you could just share your voice in your own words, and then we'll certainly have a conversation. And selfishly, by having these podcasts, I've learned so much because that's really the opportunity where I can talk to almost any physician across the country. I have 15 to 20 minutes of their undivided attention. I can ask them any question I want. So I've learned myself a tremendous amount by talking to and listening to these people from anywhere in our healthcare system. So it's been quite a journey for me. It's not something that I definitely planned when I was in medical training. I've learned so much over the last 20 to 25 years that I've been doing this, and I look forward to doing it for many more.
Well, thank you, Kevin. I love all of that. And also, I've said so many times every time a doctor shares their story, another doctor feels less alone. And that's just so true. And I love that you spotlighted being vulnerable because all any human wants is to be seen and heard and valued. And as doctors do let little pieces of themselves show and share their stories, they're generally pleasantly surprised at the reception they get and that it's nobody's judging them, nobody's thinking they're weak. It's all very supportive, and then other doctors are saying me too. So thank you for being my guest today again, and I hope you know how much I appreciate you.
Thank you again so much, Kim, and thanks for all you're doing.
You're welcome. So, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients, patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.